Hello, my name is Dr. Gretchen Reis. I have a Body Logic M.D. practice in Charlotte, North Carolina, where we practice anti-aging, integrative, and functional medicine. After having practiced in primary care medicine for so many years, it basically just got rather frustrating, treating patients that had so many different types of chronic medical conditions, and I just felt like I was giving them medicine and another medicine and another medicine for this, and then creating side effects and giving more and more medicines. And I thought, wait a minute, there's got to be a better way. So my passion is working with people on lifestyle change, saying, okay, you're pre-diabetic, what can we do to turn this around so that you don't end up on medication within a year and you're not on insulin in 10 years, and then you're not going to have a heart attack 20 years down the road. Let's stop the process now, and let's talk about nutrition and lifestyle, and let's see what we can do to really optimize your health now, get you back on track to where your body's designed to be in full wellness, and let's see if we can avoid increasing your list of medications over time. I am working through the Fellowship in Anti-Aging and Integrative Medicine, and it has been a fantastic resource for learning an entirely different approach to medicine. Conventional medicine is pretty much diagnosis focused and symptom focused. For example, you have headaches, that's your diagnosis, here's the drug for that. But with this approach, it's completely different. It's saying, why do you have headaches? Why are you tired? Why do you have fluid retention? Let's get down to the root of the matter. And learning the biochemistry and the physiology to get to the root of the problem enables you to target your therapy to really make a difference. So we're not just suppressing symptoms to make the patient go away and make them happy. We're saying, let's get rid of the symptoms. Let's fix the underlying abnormality and get you feeling better because you really are better, not just because we mask the symptom. Probably the most useful testing that we do is the hormone level testing. And the way I was trained is a menopausal woman would come in and say, I'm having hot flashes and I can't sleep, and everybody would immediately say, oh, your diagnosis is menopause, here's your hormone prescription. Well, we have a better way of doing that now. We can look at those symptoms and say, let's check your hormones and find out exactly how high or how low they are. For example, women that are going into menopause oftentimes have typical menopausal symptoms, but their estrogen isn't quite dropped yet, and it would not be optimal to start the estrogen. But there's other hormones that are out of balance, and if you work on those and get those back into balance, you may not necessarily need estrogen at that time. There is clearly a rise in low testosterone or low T, as is mentioned in the media, and I'm glad for that exposure because a lot more men are saying, I have some of these symptoms, maybe I have low testosterone. So they are coming in with that question. But in addition to testosterone, we oftentimes find other hormones that are imbalanced. For example, low DHEA. Also cortisol, which relates to stress levels. And you really are not going to be very effective if you just treat one hormone level without looking at everything, looking at the whole picture. You can maintain cognitive function, you can enhance cardiac function, decrease your risk of heart attacks and strokes, you can help prevent diabetes. There's a lot of chronic disease that you can decrease your chance of having if you optimize your hormones. There is definitely an epidemic of obesity, and it's multifactorial, meaning there's a lot of different reasons for it. Part of that is the standard American diet, and there's a lot of misinformation out there. There's the grapefruit diet, the Atkins diet, the South Beach diet. There's a lot of different diets that come and go. So we really do like to look at the science and say, why are people overweight? Is it just what they're eating? Is it when they're eating? Is it why they're eating? And then you look at all the other hormones that do interact with weight. And when you identify all those factors and give the patient a targeted approach to say, this is weight I think you should be eating, let's set out a plan, let's optimize your hormones, let's use some supplements, that's where you're going to have the most results in terms of successful weight loss. Exercise is really important for everybody to work into their lifestyle. The key with exercise is finding something that you enjoy doing. And it's important too that you have a mix of different types of exercise. You need some cardio exercise, but you need some strength training as well. There's research on both types of exercise and they're both important. But what's most important is just starting small, carving out even 10 to 15 minutes a day to do something, and then working your way up from there.
A 6-year-old at home, and when I started the search, she was about 3, so I would go to doctors and just tell them I had no energy and that, well, you're a mother of a 3-year-old. You know, of course you don't have energy. But it was something deeper than that. I was so tired, and my hair was falling out. I just did not feel myself. And I'm usually a very energetic person. I always was my whole life. I went through several doctors actually, and each one of them would tell me that normal range. They checked my thyroid, they checked basic blood work, like blood count and certain things, and they said, oh well, you know, you need to find ways to relieve stress, do yoga, different things like that, and nothing worked. And I saw the Oprah show with the Body Logic and the bioidentical hormones. I said, I'm gonna try it, and I'm so glad I did. So I started on progesterone, felt a little better, but as I now know with the whole bioidentical, it's a symphony. So with the progesterone and the thyroid, now I'm myself. Yeah, so now I think I've been on my thyroid medicine 6 months, and sleeping, happy, playing with my child at the park, going down the slide, chasing her, going to the beach. I'm back to myself.
If you'd like more information about my practice, you can go to bodylogicmd.com and search by state. I'm located in Charlotte, North Carolina.